Hi, my name is Megan. I am going to be your nurse. We're going to complete a full body assessment on you today. Is that okay?
That is perfectly
Perfect. Provide privacy. Can you confirm your name and date of birth?
Xavier, April 25th of 1988.
Thank you so much. And do you know where you are?
I'm in my kitchen.
Perfect. Do you know today's date?
February 23rd, 2024.
Perfect. And who is the president?
Biden.
Thank you. So patient seems to be conscious and oriented. Their facial expressions and hygiene and everything seems to be appropriate. And there are no apparent hearing, vision, or speech issues. So we're going to move on to the head assessment. Everything appears to be symmetrical. Are you notice any drooping of the face?
No.
No? Okay, perfect. And then we will move on to your ears. Everything seems to be symmetrical. Are you having any ringing of the ears?
Nope.
Perfect. And then we would perform a hearing test. It would be the whisper test. So you'd be about arm's length away. You'd say a combination of 3 letters and or numbers. We'd whisper it and they would have to repeat that back. And then we're gonna move on to your eyes. We're looking at the pupils. They appear to be equal and round, about 4 millimeters. And then we're going to check them if they are reactive to light. So we're gonna have you look forward. And they appear to be reactive and accommodating. So we're gonna have them stare at the pen and follow it. And they are accommodating. And we're going to move on to the nose. Are you having any nasal drainage?
No.
Okay, perfect. And then we're going to test for patency. So you're going to hold over one side, breathe in, other side, breathe in. Both nostrils appear to be patent. Now we're going to move on to the mouth and throat. So we're going to have you open. I'm going to check the oral mucosa. Appears to be pink and moist. No visible decay in the teeth. And then, are you having any difficulty swallowing?
No.
Okay, can you go ahead and swallow for me? Okay, and then we're going to check your throat. Everything appears to be midline, no issues there. Alrighty, and then we will move on to neuro. Are you having any headaches?
No.
Okay. We do just want to go over the Glasgow Coma score. So it is a baseline of your consciousness. It's rated from 3 to 15. 15 is good. 3 is going to be the worst level of consciousness. It's separated into 3 different categories. It'll be eyes, verbal, and motor. And depending on your level of consciousness, there's different grades. And now we will move over to respiratory. So his breaths now seem equal and unlabored. Are you having any difficulty breathing?
No.
Do you have any sort of cough or mucus? Okay, perfect. We're going to go ahead and listen to his breath sounds. Each time I move the stethoscope, I just want you to take a deep breath in. So we're listening to the right upper lobe, left upper, right middle, nope, we're going to listen to the right or left lower, right middle, and then we'll listen to the sides. It's going to be the right lower and the left lower. We'll listen to the back. We'll go to right upper, left upper, left lower, right middle. Perfect, everything sounds good. Alrighty, and then we're going to go over a couple techniques. So we have the turn and deep breathing cough, as well as the incentive spirometer, where you inhale really deep and hold it. We like you to do that 10 times per hour. Both of those are for to prevent any mucus buildup and prevent you from getting like pneumonia, things like that. And then we will move on to your cardiac assessment. So I'd have the patient at a 45-degree angle and have them turn their head. I would check for jugular vein distension. It is negative for that. We are going to listen to his heart sounds. So we would go to the second right intercostal space, listening for aortic. You can breathe normally. And then we'll go to the left intercostal, that is pulmonic. To the third, that is herbs. To the fourth, that is tricuspid. And the fifth, and we'll go mid-clavicular, that is mitral. Everything sounds good there. And then we will check your pulses. We'll check the radial on both sides. Bilaterally, it is 2+. Dorsalis pedis, we'll listen on both sides of the feet, that is 2+. Posterior tibial as well, that is 2+. When we're down here, we'll check for edema on the legs. Everything looks good. And we'll check for edema on the arms. That is good. Capillary refill. That is good as well. Less than 3 seconds. The capillary refill. Are you having any chest pain?
No.
Perfect. Sounds good. And then we will move on to gastro. For respiratory and cardiac, I would also listen to all the sounds that would be directly on skin, not above clothing. For gastro, I would inspect the skin, say everything looks appropriate and normal. At that point, I would auscultate and listen to the abdominal sounds, and the 4 quadrants would start at the lower right, the upper right, upper left, lower left, and that appears to be normal intensive. And then we'd listen for bruits at aortic, renal, and iliac. Those sounds, brewy sounds. And then we would palpate each quadrant, so the lower right, upper left, lower left. Are you having any stomach discomfort? No. Okay. When was your last bowel movement?
This morning.
Perfect. And are you passing gas normally?
Sure.
Awesome. And then move on to urinary. Are you having any difficulty urinating?
Nope.
Okay, perfect. And then we would move on to musculoskeletal. So what we do bilaterally, we will test for the flexion and extension of the arm. Are you having any elbow pain?
No.
Okay, so this is extension. I would hold it with my non-dominant hand on the elbow. We'd have him flex. I'm feeling for crepitus. You can extend again. And then I want you to push against me, pull against me. Perfect. And then I'm going to check it bilaterally. Have you flex and extend, and then push, pull against me, push against me. Perfect. And then I'll have you do your arms out like this. That is supination for the forearms. Put them down, pronation, and we'll check and turn against, pull against. Perfect. And push. Perfect. Both the elbow and the forearms are grade 5. And then we're going to check the knees as well. So he is flex and extend. Flex and extend. And we'll have him push and pull. Push and school. Grade 5 for the knees. And then we'll have him dorsiflex, push against, push down. That's pedis pedal flexion, push up and down. And that is grade 5 for the ankles as well. And then at this point, I would have him stand up. Would also check gait, but due to limited space, we're not going to do that. I would have him walk on his tippy toes and then do the toe-to-toe walk. And then we'll check for balance. So we'd have him hold his hands by his side. I'm going to put my arms next to you. You're going to close your eyes. Check for about 5 seconds. You can open your eyes. There was minimal swaying, and that should be it.